Podophobia, fear of feet. Podophobia comes from the Greek podo, meaning foot, and phobia, meaning fear. It is an intense and irrational fear of feet, whether your own or those of others. People with podophobia may experience extreme anxiety when seeing or touching feet. Some avoid beaches, swimming pools, or even taking off their shoes at home. Researchers believe this phobia may be linked to traumatic childhood experiences or even a sensory aversion to the touch or texture of feet. Some studies suggest that podophobia may also be associated with obsessive-compulsive disorders, where the person develops cleaning or avoidance rituals. Podophobia is more common in women than in men and often develops after a specific event, such as a fungal infection, an injury, or an uncomfortable encounter. People with podophobia describe feet as sticky, damp, or uncomfortable to look at. This sensory aversion is so strong that it can prevent someone from going to the beach, wearing flip-flops, or even being in environments where others are barefoot. The impact on daily life is significant, affecting relationships, social life, and even the ability to take care of one's own personal hygiene. Trichophobia, fear of hair. It can be hair anywhere, on your own body, on other people's bodies, or even loose hair on a comb or the floor. People with this phobia may panic at the sight of a falling strand of hair or when touching hair. Some avoid hairdressers, while others cannot even comb their own hair. The origin of this phobia is often linked to traumatic experiences, such as choking on a strand of hair in childhood or having a severe allergic reaction. Trichophobia is frequently associated with obsessive-compulsive disorder and trichotillomania, a condition where a person compulsively pulls out their own hair. There is a bidirectional relationship between these conditions. The fear of hair can lead to trichotillomania, and trichotillomania can intensify the fear. People with trichophobia describe hair as disgusting, sticky, or invasive. This aversion is so intense that it can significantly affect social and professional life. Many people with trichophobia avoid haircuts, leading to long and unkempt hair, which creates a cycle of social isolation. Others avoid being near people with long or loose hair, limiting their social interactions and job opportunities. Amphilophobia, fear of belly buttons. This might be one of the most unusual phobias on the list. People with amphilophobia may panic at the sight of their own belly button or those of others. Some cannot even touch it, and others avoid clothing that leaves the navel exposed. The origin of this phobia is fascinating. Psychologists believe it may be linked to an aversion to the concept of separation from the umbilical cord, or a traumatic experience involving the navel in childhood. Some cases are associated with infections or inflammations in the navel that left lasting psychological marks. People describe belly buttons as disturbing, repulsive, or frightening. This aversion is so strong that it can prevent someone from going to the beach, wearing a bikini, or even showering without covering the navel. The fear can extend to avoiding examining one's own body or allowing others to see it, affecting intimacy and sexual life. Emetophobia, fear of eyes. Whether it is seeing your own eyes in the mirror, looking into other people's eyes, or being near people with eye problems. This phobia is particularly debilitating because the eyes are a central part of human communication and social interaction. People with emetophobia may avoid eye contact, which affects their ability to communicate effectively, make friends, and maintain relationships. The origin of this phobia may be linked to traumatic experiences involving the eyes, such as an eye injury, a serious infection, or having witnessed something disturbing related to eyes. Some cases are associated with body dysmorphic disorder, where the person becomes obsessed with the appearance of their eyes. Emetophobia can also be related to social phobias, where the person fears the judgment of others through eye contact. People with emetophobia describe eyes as disturbing, invasive, or scary. This aversion can lead to extreme avoidance behaviors, such as not leaving the house, constantly wearing sunglasses, or avoiding any form of eye contact. The impact on professional and social life is profound, affecting job interviews, public presentations, and personal relationships. Odontophobia, fear of teeth. It can be a fear of your own teeth, other people's teeth, or specifically of dentists and dental procedures. People with odontophobia may avoid dental care for years, which leads to even worse oral health problems. Some are afraid to smile or talk to others because of their teeth. The origin of this phobia is frequently linked to a traumatic experience at the dentist's office, pain, lack of control, or an insensitive dentist in childhood. Odontophobia is one of the most common phobias. It is estimated that 9% to 15% of people have some level of fear of the dentist. The fear often worsens with age because people avoid dental care, develop problems, and the fear intensifies. There is a vicious cycle. The more someone avoids the dentist, the worse their oral health becomes, and the more fear they develop. People with odontophobia describe the experience at the dentist as a loss of control, invasive, or painful, even when the procedure is painless. This phobia can lead to serious health consequences, including cavities, tooth loss, infections, and even heart problems related to chronic oral inflammation. Bromidrophobia, fear of body sweat. People with bromidrophobia can panic when sweating, whether during physical exercise, stressful situations, or even on hot days. Some avoid activities that cause sweating, such as exercise, physical work, or even going outside on hot days. The origin of this phobia may be linked to an aversion to body odor, the texture of sweat on the skin, or traumatic experiences involving excessive sweating in childhood. Bromidrophobia is frequently associated with social phobias, where the person fears being judged for visible sweat or body odor. Some cases are related to social anxiety disorder, where the person becomes obsessed with the possibility of visible sweating during social interactions. People with bromidrophobia describe sweat as repugnant, uncomfortable, or humiliating. This aversion can lead to extreme avoidance behaviors, such as not participating in physical activities, avoiding going out in public on hot days, or wearing inappropriate clothing for the climate to try to hide sweat. The impact on professional and social life is significant, as the person may avoid situations that cause sweating, limiting their opportunities for work, exercise, and social interaction. Furthermore, anxiety about sweating can paradoxically increase perspiration, creating a vicious cycle of fear and avoidance. So there you have it, 6 of the strangest phobias related to the human body. None of these phobias are weak or irrational to those who experience them. For these people, the fear is real, debilitating, and deeply affects their lives. The good news is that all of these phobias are treatable with exposure therapy, cognitive behavioral therapy, or medication. Gradual exposure therapy, where the person is slowly exposed to the object of fear in a safe environment, has proven particularly effective. If you have one of these phobias, know that you are not alone and that help is available. Millions of people around the world deal with specific phobias, and with the right treatment, it is possible to regain quality of life and freedom of movement. If this video was helpful, leave a like, subscribe for more content on phobias and mental health, and leave a comment saying which of these phobias surprised you the most.